Caring for critically ill and therefore very vulnerable patients that suffer from acute fecal incontinence associated with diarrhea, or AFID, is a challenging, time-consuming and often complicated task. Up to 40% of all ICU patients will at some point during their ICU stay develop fecal incontinence, with the increased risk of perianal dermatitis, cross-contamination, decubitus formation, infection, discomfort and pain. Invasive fecal management systems are widely used to care for patients with AFID. However, the unit price of these invasive systems is high compared to non-invasive systems. Furthermore, there is a risk of damage to the rectal sphincter, internal pressure ulcers, and hemorrhage within the rectal pouch. Invasive products are also generally uncomfortable for the patient, and there is expected leakage of stool around the device. A non-invasive system would be preferable. However, when using standard hydrocolloid-based collection bags, it may be difficult to obtain a proper seal, leading to leakages and drop-offs of the collection device. There are no perfect solutions for managing fecal incontinence. This leaves a gap in the market for a non-invasive system which is easy to apply, with a good success rate and above all that is comfortable for the patient. Furine's external fecal catheter is the first non-invasive catheter on the market. It is a unique, cost-effective and non-invasive fecal management system that allows nurses to care for critically ill patients. With Furine's non-invasive fecal management system, there is no risk of damaging the rectal sphincter, no risk of internal pressure ulcers, no risk of hemorrhage within the rectal pouch, no pain or discomfort related to the catheter. In addition to the clinical advantages of a non-invasive product, there is also an economic advantage. It is possible to cut costs when choosing Furine's non-invasive fecal management system when compared to standard invasive fecal management systems. The Furine system comprises of a flange with a very soft, comfortable and elastic silicone adhesive to stick to the patient's skin, and a silicone tubing with an attached collection bag and charcoal filter. Also included in the set are medical skin wipes to prepare the skin before application of the catheter, adhesive barrier film, which creates a protective moisture barrier on the skin and furthermore enables a strong bond between the catheter and the skin, and a catheter applicator for ease of application. Furine's external fecal catheter is developed to improve the safety and comfort of the patient. It is chosen due to the non-invasive application, as well as being simple to apply. Patient comfort is also a main attraction, in particular when mobilizing to sitting position. The soft, flexible adhesive material gives a pain-free attachment and enables the catheter to conform to each individual patient and to body movements. Feedback from users highlights a decrease in caregiver workload, a decrease in acute perianal dermatitis, pressure wounds and cross-contamination, as well as faster rehabilitation and likelihood of earlier discharge of patients from the ICU. Contact us today and discover how you can cut costs while improving patient comfort and safety with the Furine non-invasive fecal management system.